is Chapter 15 out of your ward in Hisley, Caring for the Postpartal Woman and Her Family. So, fourth trimester begins immediately after childbirth. Immediately, the woman will be in a phase called Puerperium. It's the first 6 weeks after birth, and it's really important, especially during that first hour after birth, that you're closely observing the mom, identifying for hemorrhage and any complications, that you're supporting her and doing ongoing education. So safety for the mother and infant. You want to prevent infant abductions. I think most hospitals have gone to some sort of like alarm system, hug system as an example, where mom and baby will have bracelets on, and it will beep when they match. And then if someone tries to take the baby out of the OB unit, it will alarm. So early maternal assessment. That's crucial. Expect that the mother will have an elevated temperature at the first 24 hours, but if it's above 100.4 or 38 degrees Celsius, that indicates some sort of infection. Expect some bradycardia because of an increase in stroke volume, but a decrease in venous blood flow to the heart. The mother will experience some hypotension. Just make sure that you're considering safety, encouraging the mother to move slowly from lying to sitting and sitting to standing positions. And respirations will be normal. You're going to assess the fundus immediately postpartum. It'll be halfway between the symphysis pubis and the umbilicus. And then after an hour, it should be level with the umbilicus or about 1 finger breadth above. And then every day it's going to descend 1 finger breadth down. You're going to assess the lochia, which is like an accumulation of blood, tissue. You're going to do a perineal assessment. You're going to want to use the acronym RETA, and that is assessing for redness, edema, ecchymosis, drainage, and approximation. The patient might have hemorrhoids, so you're going to want to teach comfort measures, like they can use ice packs, like frozen peri pads. The sideline position will be comfortable, but the hemorrhoids usually disappear. You're going to want to do there's an assessment called bubble heat, and this is assessing the breast, uterus, bladder, bowel, lochia, and an episiotomy. You'll want to make sure that you're assessing for maternal pain, home ensign, emotional status, and bonding. So the breast assessment. You might notice that the breasts are firm, that they're filling. You're going to want to assess for any nodules, fissures, cracks. Make sure that you're looking at the nipple, to see if it's erect or inverted. Make sure that you're assessing for pain. So the uterus. So the uterine contractions will control bleeding. Placental expulsion will occur within 15 minutes after birth. And it's really important to palpate the uterus. You'll be doing a fundal assessment. Again, the location right after birth, we talked about it. It'll descend 1 centimeter or finger breadth a day. You're going to assess the consistency. It should be firm. If it's boggy or soft, that can indicate some bleeding. And if that happens, you're going to want to massage it to see if it firms up. You're going to want to assess the location and the height. Again, it's measured in finger breadths. A full bladder could skew that height of the fundus because it pushes the fundus up and over to the right. So after pains, it's more pronounced in a multipara. and it'll occur during the process of involution. So you're going to want to explain the cause, encourage sitz baths, those might be comforting, ambulation, you can administer some analgesics like some Tylenol. The bladder, we want mom to spontaneously void within 6 to 8 hours postpartum. You're going to want to monitor that first void, and tell the mom that diuresis is going to start happening. Urine output can reach up to 3,000 milliliters per day. But usually after 2 to 3 days postpartum, the normal urine volume will return to pre-pregnancy levels. Make sure that you're watching for urinary retention, over distension, and making sure that mom is completely emptying her bladder. So bowel. Right after childbirth, mom is going to be hungry, exhausted, especially if it's been a very long labor. And she can have a lot of constipation. So some strategies to prevent that is to ambulate early, drink plenty of fluids, and eat a high fiber diet. Lochia. So as I mentioned before, lochia is like an accumulation of blood tissue. Right after birth, lochia is going to be what we call lochia rubra. It's red in color, and because it's mostly composed of blood. About 3 to 4 days after, that should lighten up and it becomes what we call lochia serosa. And then about 10 to 14 days postpartum, the patient will have lochia alba, and that's like a white, yellowish color. And if the patient, like say they're 10, 11 days after having their baby, they go from lochia alba back to lochia rubra, there's a problem because they could still have parts of the placenta in them that didn't completely come out. So that would be an indication to go back into the provider. The lochia shouldn't be very odorous, because if it's really, really odorous, that's indicative of infection. You're going to want to document the amount, if there's clots, what kind of lochia, how often mom's changing her pad. The episiotomy. This is a surgical incision that they may need to do. It's usually 1 to 2 inches, and again, assess using Rita. The patient may need ice for 24 hours. And then after that, like sitz baths will be helpful, and then hot packs. Metergine. This is a med given to prevent any postpartum hemorrhage. So again, monitoring the lochia, if there's any bleeding from the episiotomy. It's contraindicated in hypertensive or patients with like preeclampsia or eclampsia. The pain assessment. Determine the source, location, type, duration, like we do with any patient. You can administer Tylenol or ibuprofen. You can give sitz baths. You can use non-pharmacological, like music therapy, massage, relaxation type strategies. You're going to assess for DVT. The Homan sign, that's when you dorsiflex the foot, and if the patient has pain, they could have a DVT. But this isn't definitive or 100% reliable. You're going to want to look for erythema, unequal calf circumference, warmth, pain. Emotional status. Mom might be experiencing a wide variety of emotions. They could become sad the first 1 to 2 weeks postpartum. They could have the baby blues, which is pretty common, and we'll talk about that more later. So, by system, hematological system. Again, mom's going to have a decrease in blood volume, and that's because of blood loss, diuresis. So, the white count is going to be increased about 5-fold, or increase 5 to 6 days, excuse me. The fibrogen will increase, and then it returns to normal by the 3rd to 4th week. So hormonal levels, estrogen and progesterone will decrease, and lactogen, cortisol, growth hormone, and insulin levels will decrease. The neurological system, mom's going to have altered sleep patterns. You know, with new baby, she may experience some maternal fatigue. If she has some numbness in her legs or dizziness, make sure that baby and mom are safe. Mom could experience some headaches, so make sure that you're assessing vital signs, especially that blood pressure, and that you're implementing environmental interventions like dimming the lights, keeping it quiet. Food and electrolytes. The GFR, creatinine, and BUN will return to pre-pregnancy levels within 2 to 3 months. The patient will have some proteinuria. And again, they're diuresing. I mentioned it could go up to 3,000 mLs per day. Respiratory system. The patient could experience some respiratory alkalosis. They're going to have a decrease in intra-abdominal pressure. So during that, sometimes second, especially 3rd trimester, you know, mom has all that pressure on her lungs, and so she might get short of breath easier. Well, this is going to get better after baby comes out. Integumentary system might have some stretch marks. That linea nigra will disappear. Cardiovascular system. Again, the cardiac output will still be elevated. They're diuresing a lot. Make sure that you're monitoring the cardiovascular system closely. The immune system. If mom is Rh negative but gave birth to an Rh positive baby, mom is going to need that Rogram within 72 hours after birth. Because if she ever has another baby, you don't want those, you know, mom's own body attacking the next baby. Mom might need a rubella vaccine. If they'll draw tighter to see if she's immune to it. She will only need rubella if she's not immune. Make sure that you're getting the signed consent form. Mom can experience some flu-like symptoms like fatigue, nausea, joint pain, and she'll need to avoid pregnancy for a month after that. Reproductive system. Involution of the uterus will occur, so it'll return to that normal state within 3 weeks. The placental site will start healing. The labia will be kind of flaccid. So for non-lactating women, menstruation should occur in 6 to 8 weeks. The first cycle might be a little irregular. If the woman is breastfeeding and lactating, menstruation will be delayed, as well as ovulation. So at that point in time, mom might need some contraception if they're not planning on having another little one right away, because, you know, ovulation will precede menstruation. GI. We're going to have a decreased gastric motility, so constipation that they've already been dealing with during pregnancy. It doesn't get any better right away. They can have the decreased muscle tone in their abdominal wall. They can actually have what we call rectus abdominis diastasis, where their abdominal muscles literally split in half. So to correct that, make sure that the patient has correct posture, and they can do modified sit-ups to strengthen those abdominal muscles and heal. They will have body aches. They're going to be fatigued, just exhausted after birth. So enhancing cultural sensitivity. Make sure that you know some of the customs and rituals of your patients of different cultures. Make sure that you're doing that cultural assessment. Activity and rest. You're going to want to make sure that mom gets up and ambulates postpartum. That's really, really important. That she's doing mild exercises like Kegel exercises to increase those pelvic floor muscles. And exercise should increase gradually. Mom should not go run a marathon right after she gets out of the hospital. You want to encourage frequent rest periods and try to promote some rest and sleep for mom. Nourishment. Mom should expect some weight loss. Ideally, mom's weight should go back to normal 6 to 8 weeks postpartum. We know that doesn't always happen. But mom should expect at least a 10 to 12 pound weight loss immediately, because baby's coming out, the placenta is coming out. Right after birth, mom's going to be very, very hungry. She may need an iron supplement if her hemoglobin's low, and then she'll need to be on a multivitamin. A lot of physicians will just encourage mom to keep taking some of those prenatal vitamins for a while. Elimination. You want to encourage voiding every 4 to 6 hours. You're going to monitor I&O, especially for that first 24 hours. We talked about all of that, that mom's diuresing all that fluid. They have an increased risk for UTI because of urinary retention and that constipation. You're going to want to make sure that mom's doing good peri-care. So again, she's at such high risk for infection, especially if she's had an episiotomy. So you have that incision, it's, in a place where there's lots of bacteria. So make sure she's washing her hands with pad changes, using a peri bottle and spraying front to back, wiping front to back. Tampons are contraindicated, no using tampons. And if mom has had a C-section, the nurse will provide peri-care until the patient is ambulatory. Ice packs are, we need to use those for the first 24 hours because they reduce edema, they'll reduce pain because they vasoconstrict and then they numb the area. So you want to apply for 20 minutes every 2 to 4 hours. Afterbirth pains, again, the uterus will contract during involution. That will happen for 2 to 3 days. You can give mom mild analgesics. Special considerations, women with HIV and AIDS, make sure that you are protecting yourself. Make sure that you're using safety glasses, gloves, and really discourage breastfeeding because that is a method of transmission of HIV, and it will increase baby's risk if mom breastfeeds. So the surgical patient, there are several different surgeries that may go on. If mom hasn't had a vaginal delivery, she's had a cesarean birth. So you really want to monitor that wound, watch to make sure that before mom gets up, anesthesia has worn off. She might be a little bit dizzy. Make sure somebody's walking with her. And tell mom not to get up without somebody. Again, monitoring that wound for signs and symptoms of infection. Watching for orthostatic hypotension. Encouraging that coughing and deep breathing. Mom might decide to get her tubes tied, which is tubal ligation. So they are, again, NPO after midnight, and then monitoring her after surgery. So infant feeding choices, there's breastfeeding or bottle feeding. Whatever mom's choices you want to educate and support. So lactation. So prolactin and oxytocin provides that milk ejection reflex, which you'll hear it called letdown. Mom will have like a tingling in her breast, and it's kind of a supply and demand. So if you don't feed baby or pump, then eventually that supply is going to dry up. So our goals is that baby will achieve proper latch on. You're going to watch for milk letdown, make sure that mom is in a comfortable position, and you're going to assess for infant weight gain. Ineffective breastfeeding, mom can have some nipple trauma from incorrect latch on. She can have some breast engorgement. So to express that breast milk, she can do it manually. There can be an electric pump. They have single and double breast pumps. So when mom wants to start weaning baby off breast milk, getting rid of that one feeding at a time. Generally, they'll take the first feeding out will be the feeding that the infant really won't miss the most. Formula feeding, so some safe practices, making sure that the formula is not too hot, so test on your inner forearm. Infant and family bonding. So transition to parenthood is big, especially for the new mom. You want to encourage bonding with dad. So encourage dad to hold baby, change diapers. So some factors that can interrupt bonding is like stress, lack of finances. If mom is an adolescent. Siblings, they may become jealous. So try to involve the siblings. Some hospitals will do classes for siblings, really encourage that, big brother, big sister role. You're going to want to involve the grandparents. Being a grandparent is special. So emotional events. Baby blues, it's normal for the first 1 to 2 weeks. But after 2 weeks, mom could develop what we call postpartum depression. They'll have a lot of sadness, they'll be fatigued, and that's when you really need to make a referral, because you don't want it developing into a postpartum psychosis where mom has hallucinations, irrational behaviors, because that can impose a safety threat for mom and baby. So you're going to want to teach self-care. Mom needs to make sure that she's assessing her lochia, so education is important, making sure that her fundus is going down. We talked about hygiene, using the peri bottle, changing the pads, making sure mom washes her hands, monitoring that incision, if they've had a C-section, taking her temperature, because again that could indicate infection. Like stool softeners, high fiber diet, tons of fluid. To prevent that constipation, making sure she's emptying her bladder, and monitoring for signs and symptoms of UTI, that she's exercising, eating healthy, trying to get some sleep. It's really hard with a new infant, that she's managing her pain. So sexual intercourse, usually the physicians will say no sexual intercourse for 6 weeks, and making sure that when sexual intercourse is initiated that mom is using some sort of contraception, unless if they're planning for another baby right away. So special needs population, this is like adolescent mothers. They need a lot of support and referrals. Again, not being judgmental. Women placing their infant up for adoption. A lot of times it is these adolescent mothers. So make sure that you give the woman time to see her baby, hold her baby. You'll need to make a referral, and again, don't judge. You know, it's really unfortunate when patients can hear, you know, the staff talking about them. Do not let that happen. You know, because sometimes a woman might not have the means, you know, financially, or have that support to be able to take care of that infant. And you know, there's a lot of families that can't have babies that, you know, can financially support that baby. So do not be judgmental. Older mothers, you're going to want to, this is like 35 and older, monitor for other health complications, provide them with support. So you can refer mom to support groups. There's groups for like new time mothers. A lot of times there's like home health or public health that will do home visits, telephone follow-up, and mom will need to go back to the clinic